Welcome back to Motors in Medicine. On today's episode, I'm going to be discussing the similarities and the differences between true sciatica and piriformis syndrome. Now, let's do a little background. First, what is sciatica? So, true sciatica by definition is a condition in the body where you have a nerve root impingement or compression of the sciatic nerve, typically at the L5-S1 disc location. What that means is that there's either a disc bulge or a herniation or an extrusion of some sort that's kind of pushing against the sciatic nerve, impinging it, if you will. And at that level in the lower spine, it's going to cause a radiating sign and symptom down the leg. And if it follows the S1 nerve root, then the sign and symptom, if you will, the pain, tingling, numbness, whatever it is, can extend all the way down to the foot, okay, on either side. Now, that's true sciatica, and it's typically caused by some type of lumbar injury, or if there's some type of dysfunction at the L5-S1 level, whether it be degenerative disc disease where the disc itself has become so worn out that now the bone above and below is kind of slipping over one another. That's called a listhesis. And what that results in is, again, this pressure along that nerve root. Now, the other condition that can cause sciatica or mimic sciatica is known as piriformis syndrome. Well, what's piriformis syndrome? Well, the piriformis is one of 6 external rotators of the hip. Now, the hip is essentially just the ball and socket joint on either side of the hip, on either side of the lower back and pelvis, where the head of the femur inserts onto the hip socket. Okay, it's a ball and socket joint. And what the external rotators of the hip do, and like I said, there's 6 of them, they basically just take the hip and rotate it externally to allow for easy twisting motions, left or right. That's probably the easiest way to explain it. The issue is that the piriformis muscle, it's one of those 6 external rotators. The piriformis muscle lies right next to that sciatic nerve. And now this is much lower than the lumbar level, of course. This is much lower. This is right in the buttock level. And so the issue is that if the piriformis muscle has been injured or bound up or overstretched, and this happens a lot in athletes, for example. If any of those things have happened to the piriformis muscle, it can get inflamed. When it gets inflamed, it can create a pinch or an impingement upon the sciatic nerve at that lower level. And that can mimic the same symptoms that true sciatica from a disc can cause. In fact, those symptoms can be pain, numbness, tingling, and depending on the level of compression, it can also reach down as far as the feet and toes. So it's important to distinguish the difference between the two. And if there's an injury involved, was the injury due to something in the lower back, like heavy lifting, improper form, which would most likely be an L5-S1 disc injury causing true sciatica? Or was it some other type of injury where maybe you lunged into a certain position or squatted down, rotated a little bit, and lifted something a little too heavy, but you were using the right form? In this case, the muscles of the buttock got injured, potentially causing this issue to arise. Or the piriformis itself was injured from some type of forced external rotation of the hip. So these two conditions, although very similar, are very different. A true sciatica, an L5-S1 disc lesion or injury causing compression on the nerve root, usually the S1 nerve root, That type of injury is usually something that tends to become more of a permanent injury unless you create a decompression. In other words, you remove that portion of the disc that's causing compression on the nerve. It's that simple. However, piriformis syndrome, on the other hand, is typically just inflammatory and or muscular. So piriformis syndrome is easier to treat, far more common than true sciatica, unless you're an older person or a person that's sustained a lot of lower back injuries. Piriformis syndrome, like I said, is more muscular and inflammatory in nature. And through simple acts of stretching and modalities of ice, heat, anti-inflammatories, that condition can be treated and you can mitigate the compression on the sciatic nerve and eliminate the symptoms going down the leg far easier than you could from, say, a true sciatica at the L5-S1 level. True sciatica at that L5-S1 level, where there's nerve root compression on the S1 nerve root, typically is going to require a little bit more in the form of treatment. And that can vary anywhere from an epidural injection to, again, like I mentioned, a decompression, like a microdiscectomy where a portion of the disc is removed to get the pressure off the nerve. There are different variations of treatments that can happen there, but they're going to be more involved. So just wanted to give you guys some information on these two similar but different in treatment conditions that occur very frequently. However, the piriformis syndrome is definitely more common, I would say, than true sciatica, unless you're an older person or a person that has sustained a very significant lower back injury, such as one that would be consistent with, say, a motor vehicle crash or something of that nature, or lifting something exquisitely heavy and creating either a tear or a bulge or herniation at that L5-S1 location. Keep in mind, piriformis syndrome happens even to very, very young people. And it can even happen from just sitting too long in a certain position. I don't know if you guys have ever noticed, but there's a correlation between prolonged sitting on, say, a hard surface and piriformis syndrome. Pay attention next time you are sitting on, say, a hard surface for a long period of time, and you start to feel almost like a pain right in the deep buttock region, and then you start to actually get a little bit of like shooting numbness or tingling down the leg. That's piriformis syndrome. And it's usually alleviated just by getting that pressure off. Whereas if you had true sciatica, it's something that happens more frequently and does not get alleviated by simply moving. Sometimes actually moving can create the problem or magnify the problem even further. But hopefully this information was useful, and hopefully you guys understand and appreciate the difference between true sciatica and piriformis syndrome. So if you guys liked this information, please hit the thumbs up button. And like I mentioned in previous videos, we're trying to get subscribers up to about 500 before the end of the year. So I'd really much appreciate it if you guys would subscribe if you haven't yet. And on the next video, I'm going to get back into some discussion on the Bronco. I think I've got enough information now that we can discuss likely all of the modifications that have been done to this point on the Bronco and how they've held up. So until next time, this is Motors and Medicine signing off. I appreciate all your support. Thanks.